first guest is here to raise awareness about breast cancer and talk about new technologies and treatment. Joining us here in the studio is Catholic Health's Director of Breast Surgery at Good Samaritan University Hospital, Dr. Sophia Fu. Dr. Fu, thank you so much for coming back.
Of course. Thank you so much.
This is such an important topic, and I know we have a lot of technologies to talk about, but first, tell our viewers kind of some causes of breast cancer and also symptoms.
Yeah, breast cancer is it's very multifactorial. 85% of it is sporadic, unfortunately. So there's different factors like maybe very early menarche, meaning first time you had your period, very late menopause, late first pregnancy or no pregnancies. Hormone replacements were found to also contribute to that as well. Body weight is very important. That's a big topic these days on really maintaining a good BMI. And then smoking can also play a factor. But if you ever notice a mass on your breast, very important to get it checked out. Although some of them are benign, it's good to have it evaluated. Other symptoms kind of like dimpling of the skin or any nipple changes, nipple retraction or discharge, those are all things that need to be evaluated. Swollen lymph nodes as well.
And then what's your advice for mammograms and checking yourself? I know,
Yes.
because I said now that I'm in my 40s, it's time.
Yes,
So I'm holding myself accountable live on TV. But
Perfect.
Yeah.
So definitely go and get your mammogram. We'll get you set up tomorrow or after the show.
Exactly. So
yes, age 40. Age 40 is when we want to start for the average risk person. But there are some patients that are people that are high risk. And so really coming in at age 25 to get a risk assessment to figure out if you're high risk or not will help to determine if you need even earlier screening, like at 35 or even 30 or 25. So it really depends on the individual.
very interesting. Now, you guys do such an amazing job at Catholic Health. So talk about some of these new technologies. They're very interesting, and you're here to explain it to us. Which is the first one you want to talk about?
Yeah, sure. Resensation is one of the really great new procedures that we're performing. So, we've come so far in how we treat breast cancer. We've gotten so good at, making people live longer lives cancer-free that now we're able to take a look at all the other aspects to improve the quality of life. So a lot of patients are able to undergo nipple-sparing mastectomies where we can preserve the nipple areolar complex and allow them to have after the reconstruction, the look of their native breasts. But the problem is the sensation may not be felt anymore. That could be very psychologically impactful. And so there's a procedure called resensation where we're able to use nerve grafts to reconnect the nerve endings to the nipple areolar complex so that people can regain the sensation to their chest wall. So it's really made a big impact and really improves the quality of life.
Wow, that's amazing. And there's one, let me see if I say it right, cryoablation?
Yes, freezing technology.
Right.
That's been around for a while for different kinds of tumors, but it is a technology that can be done to freeze breast tumors as well. And so the IceCure, the ICE3 trial just got published last fall with really great results on a certain subset of patients that can undergo cryoablation of early stage breast cancers, which is pretty amazing. It's actually a technology I started doing in our office at Good Sam. So we're offering it, and we're actually the first place on Long Island to offer this. So it's really come a long way.
So is it less invasive? And then
Correct.
Just
an office procedure. So as if you go in for a biopsy, it's kind of the same thing. It's a probe that gets placed into the tumor itself. It freezes it, kills off the tumor cells. So there's very minimal downtime and really great cosmetic results and very helpful for a lot of patients.
Wow, that's incredible. What other technologies are there?
Yes. So we've come a long way in how we address lymphedema. And so one of them is really trying to minimize the amount of surgery that we do for the lymphatics. And during the staging of breast cancer during surgery, we usually do have to do a lymph node biopsy in order to properly stage the patient. Some patients may not need that if they have very early disease like pre-invasive cancer, what's called DCIS, or some people are opting to undergo a mastectomy for high risk, like a BRCA mutation. They have a high risk of breast cancer. They're doing a breast mastectomy prophylactically so that they hopefully won't get breast cancer in the future. And so the problem is when we do that, we don't necessarily need to do a lymph node biopsy, but when we do the mastectomy, we kind of sever the lymphatics. So if after surgery we find that they did have cancer, which can happen sometimes, unfortunately, it becomes difficult to do the lymph node biopsy. And so in the past, surgeons would, prophylactically take out a few lymph nodes and then maybe do a little unnecessary surgery. Now we have what's called mag trace, which is a magnetic dye that gets injected at the time of the mastectomy. It gets uptaken into the lymphatics, into the lymph nodes, so that afterwards, 30 days later, because it's still there, we can then find the lymph nodes in case we have to go back for surgery. So it's really helped with, minimizing unnecessary surgery for a lot of patients.
Wow. I mean, so, I'm sure a breast cancer diagnosis is completely overwhelming, for a patient and everything. And there's so many options now for treatment, right?
Yes.
Are there any other technological advances that you want to talk about as well?
Yeah, so I guess it's also techniques and technology, but because we have more cancer survivors, we're just really paying a lot more attention to quality of life issues as well. Lymphedema is one of those topics, right, where the swelling of the arm happens after the removal of the lymphatics. So we said that the MAC trace can help to, potentially minimize. We're learning how we can minimize the amount of surgery that we do, but there's also techniques we can do at the time of surgery to hopefully map out lymphatics from the arm, called axial reverse mapping, something that we routinely do, so that we can avoid those lymphatics. And if we have to come across them, sometimes we can perform a procedure called a lympha, where we reconnect the lymphatic to a blood vessel and reestablish that flow, and thereby, minimizing lymphedema to begin with. So,
wow, just incredible.
Yeah.
We're running out of time, so is there anything that most important you want to tell our viewers?
Yeah. So, we've just come so far in how we treat breast cancer. So there's just a lot of great things that are out there to really, personalize the treatment for patients. So it's very important to not only be aware, to get your screening, and see the right person to help you in that journey.
All right, and like I said, Catholic Health, you guys are amazing. Tell everybody where they can get more information and everything else.
Yes, definitely. Catholic Health website has wonderful resources on breast cancer, and then breast360.org is wonderful, from the American Society of Breast Surgeons, American Cancer Society, and cancer.gov are all really great resources.
And I love the fact too that I feel like you're a doctor, but like you have such great bedside manner that I feel like you're my friend, that you're gonna hold my hand and would help me through anything. So we always appreciate you coming here, and with all this new information, amazing technologies that you have now at Catholic Health. Dr. Fu, thank you so much.
Thank you.
Thanks.